Thanks for joining this session. So I'll be talking about classification of study types. This is an area where many people make mistakes, and even after completing their studies and during PhD differences, you'll hear people confusing the different types of studies. So I will give a very quick summary of how to classify studies. Especially this is more helpful for clinical studies, and it can also apply to any epidemiological studies broadly, but especially this is useful for classifying clinical studies. So the first place to start is with the assignment of the exposure, and the question that you have to ask when you are trying to classify your study is um, whether the investigator assigned the exposure. The answer could be yes or no, and if it is yes, then we are dealing with an experimental study. If the answer is no, it's an observational study. Then once you know that this is an experimental study because of the exposure assignment, then the next question should be about the random allocation of the intervention. If the random allocation is done, then clearly this is a randomized controlled trial. Okay? If there is no random allocation of the intervention, then we are dealing with a non-randomized controlled trial. Okay? So this is the experimental side is as simple as that. When you come to the observational study, we have a few more steps to questions to ask. So the first question um, is there any comparison group? You know, two or more comparison groups. Do you have those in your study? If the answer is yes, then we are talking about analytical studies. If the answer is no, then this is a descriptive study. So there's a lot of confusion between descriptive observational studies and analytical observational studies. That's why I'm emphasizing this classification as an important point. Sometimes people also confuse experimental studies with observational, so it's very important to be clear with where each of these belong. So once you have the analytical study determined, then you have to look at the direction of the um, exposure and the outcome. So if you have started your study with exposure and determine the outcome, then this is a cohort study. Okay, a cohort study can be of three subtypes. One is prospective cohort, another is a retrospective cohort, and the third type is a combination of the two, which is called ambidirectional cohort. Okay, so irrespective of your data collection point, you are starting with an exposure and going to outcome. So for more details on course studies will come in another session that will take much longer time, but for now let's focus on this one. That if you have started with an exposure and gone to an outcome, and then this is a course study. On the other hand, if you started with an outcome and went back to an exposure to determine the exposure, then this is a case control study. Often this is done when the event of the outcome of interest is a rare event because it's more economical to do that. And then you have the cross-sectional study, which is a popular study, which often also is easily confused with a descriptive study. But here you have a direction. The direction of exposure and outcome is they are done at the same time. So you don't go backward or forwards. You just take a snapshot of both the exposure and the outcome. So this is called a cross-sectional study. So in short, this is a summary of a classifying study types, and you have a nice reference here in the Lancet. You can read that manuscript and learn more about it. Thank you very much.